The health care bill passed by the U.S. House of Representatives earlier this month still has some hurdles it needs to get through before becoming law. And in that process, the pro-life protections could be stripped out. To discuss the ins and outs of the health care debate and what it means for the pro-life movement, we're joined by this week's expert panel. John McCormack is senior writer at the Weekly Standard, and Marjorie Dannenfelser, president of the Susan B. Anthony List, joins us again. Good to have you both.
Thank you. It's good to be here.
John, from what you are hearing, how likely is it that the Senate will keep the pro-life protections that are in the House's version of the health care bill?
Well, no one really knows for sure, but one real expert that I talked to, a former senior Senate staffer, said it was, quote, a very close call. The rules are sort of arcane, but there is this debate about what can or can't go through with 51 votes as opposed to the usual 60 that it requires in the Senate. And we won't really know for sure until the Senate parliamentarian adjudicates and both sides get to argue before this parliamentarian make their case about whether this should or should not make it through. There is some hope in that defunding Planned Parenthood a couple of years ago. A lot of conservatives, even the Heritage Foundation, said you couldn't do that. Turned out you could. They passed the bill. Pro-life groups like Susan B. Anthony worked on that, and they passed that bill. They proved that you could do that. And so the goal of pro-lifers here, the hope is that you can analogize defunding Planned Parenthood to the issues related to the Hyde Amendment and healthcare subsidies.
And Marjorie, you said you would oppose any version of the health care bill that did not include these pro-life protections, and that an executive action would not be a sufficient substitute. Why is that?
Well, this is when it all gets really tricky. We've been through this before. John tracked this in 2010 very closely when we were looking at a health care bill that did not protect taxpayers from taxpayer funding of abortion. And we had a whole group of Democrats that said, yeah, we agree with you, we're pro-life. And then at the very last minute, they changed their mind. And they allowed this health care bill, the one that we're under now, to go through with us footing the bill for abortion. We cannot allow that to happen again. As much as we want to defund Planned Parenthood, the far higher impact piece of this legislation is the cash going to plans that would fund abortion. So as much as we would hate it, we would have to oppose it. We think actually that language will stay in. We've argued very strongly, and our allies in the House and the Senate have argued very strongly to the parliamentarian and the Congressional Budget Office that this has a big budgetary impact, therefore it should stay in the reconciliation bill. Therefore, we will be thrilled to make sure that this thing's passed with 51 votes.
So we've mentioned the parliamentarian, we've mentioned the reconciliation process. John, can you give a brief rundown as to what that is and why it's going through this route?
Well, so in the Senate for a long time now, most bills are subject to a filibuster in the last generation or so. That means that 41 or more senators can block basically any bill they want. They've created this reconciliation vehicle. It's called budget reconciliation. The idea was that if you follow these certain rules, you could pass a legislation with a simple majority, 51 votes, and it's designed to reduce the deficit, to help with the budget. So this bill, you know, as it relates to healthcare, that's why they chose this, because they've got 52 Republicans in the Senate. So you've got a very narrow margin for victory right there, very narrow margin for error. You know, when the Democrats passed this bill back in 2009, the first time in the Senate, they had 60 votes for it. They ultimately, the House went back, the Democratic House passed that bill, and then they used this reconciliation procedure themselves to make a few modifications to it. But there are these complicated, arcane rules that govern what can and can't go through, and so that explains some of the reason why the Democratic Obamacare bill was a little messed up, and it explains also why the Republican replacement, you know, isn't exactly what anyone would really like.
It is complicated. Do we know how likely it is the Hyde Amendment, which bans federal funds from paying for abortions, can get through this process?
Well, I think we both probably have similar information. I don't think anybody but God knows what's going to happen in a couple of weeks when that really gets adjudicated by the parliamentarian. But I do think that we have a great argument. What matters is that it has a budgetary impact. That is the standard, and it does have a budgetary impact, certainly in the beginning year, and a little bit less of a budgetary impact in outgoing years. But think about what we're talking about. We're talking about the budgetary impact of our paying for the deaths of children. So it really matters that we win this argument, and we're doing everything we can to make it happen.
When the House passed their version of the health care bill, there was a lot of buzz about pre-existing conditions. John, how does the coverage for pre-existing conditions in this health care bill compare to that in Obamacare?
Well, basically what it does is it sort of keeps Obamacare's regulations for pre-existing conditions for people who already have health insurance. The question is really what would happen in certain states that requested waivers and exemptions to do some things different from Obamacare for people going forward who try and get coverage, and whether or not how much you could change how much you're charging people for coverage who don't have it right now. And so the whole idea here is that you want to help people with pre-existing conditions, but also it's a problem right now. We have the way we've structured Obamacare is we've basically decided that the way we're going to help out people with pre-existing conditions is we're going to charge them the exact same as everybody who's healthy, and we're basically going to do that by raising the rates of people who are in the individual market. So people who don't happen to have employer insurance, which doesn't seem very fair. That's a real hit in the pocketbook to people who are middle class and paying thousands and thousands of dollars extra. So I mean, I think we basically have all decided as a society, as a people, it seems like there's this consensus we're going to help people out with pre-existing conditions, and so that's why the Republican health care bill it has this idea of high-risk pools where we'll have government subsidies that can help out people with pre-existing conditions. I think that makes sense, and I think there are other ways that states could experiment with making sure that people with pre-existing conditions are covered, but perhaps not exactly the way Obamacare can. What about it?
And Marjorie, how do you respond then to critics who say you can't be pro-life and support a health care bill that has this different approach to pre-existing conditions?
Well, I think John just revealed how complicated this argument is. There are prudential judgments involved in caring for the poor, and high-risk pools, and who pays for it, and what can the market bear? What is the government's responsibility? Which means what is our responsibility to the poor? But one thing is for sure is that the fundamental right to life is the first right. Without the right to life, you can't enjoy health care later. So while there's a prudential judgment on the side of how we make sure that people who have diabetes or other pre-existing conditions get taken care of, we certainly have consensus, and we certainly owe it to the unborn child who needs that guaranteed right to life. It's simply, I think, just wrong to say that it's not pro-life, that this is not a pro-life bill if it doesn't satisfy a bar that someone says is adequate for pre-existing conditions.
Healthcare is a long and complicated process. Grateful for both of your insights. John McCormack, Marjorie Dannenfelser, thank you.
Thank you.